In today's video, we're going to be unbandaging and rebandaging an anterior foot ulcer that has been bandaged professionally by a licensed podiatrist. I'm not a doctor. I'm just sharing this for informational purposes only. First of all, I'm going to take this bed liner and I'm going to place it underneath what's going to be my work area where I will be going ahead and working today to ensure that I don't go ahead and spill anything onto the floor area. Okay, as you can see, I've placed down the bed liner. This is the absorbency side. This is the non-absorbent area. So this way it will protect my work area. Next, I'm going to make sure I wash my hands thoroughly with soap and water. Okay, now that we have that completed, we are going to go ahead and put on gloves to protect our hands. Okay, now that I have my gloves on, I will be removing the sock to expose the bandage. And I want to be very slow to remove the sock in case it's tight on there. I'll be doing wound cleansing as well as wound redressing on this anterior right foot venous stasis ulcer. Now they do have it taped up top and the tape should easily come off. I'm going to pull opposite of where it is. It does look like I will need to cut it though, unfortunately. So for this, I need a pair of scissors specially dedicated for these procedures. Realistically, utilize any scissors. I do like to go ahead and place alcohol on the scissor area to ensure that it is sterile. I did wipe it down with my alcohol prep pad, and now I can go ahead and gently and carefully cut away at the tape that's there with careful precaution not to go ahead and point the scissors into the skin, of course. I've cut enough that I can go ahead and pull away better. I'll need to cut this area as well. I can make an attempt to unwrap the foot. Of course, I am running into another tape situation where I'll try to pull up the tape. Looks like there's 2 layers of tape all together. And you want to go slow, of course. And this way, by going slow to unwrap, you're not agitating the foot at all. Now they did go ahead and place a sponge pad, a gauze pad on top of the venous stasis ulcer area. So I will be removing that pad. Looks like it has gone ahead and applied together the entire contents of the oil emulsion pad as well as an alginate silver pad. So here is what we are dealing with as far as the venous stasis ulcer. There's an inside look as to its healing and how the foot overall is looking. Now I'm going to take some sterile sodium chloride and go ahead and spray it directly on the ulcer anterior foot area. And from that point, I will take a 4x4 gauze sponge to pat it dry, just to cleanse the area and wipe it a little bit. That's that, but it looks a lot better. Just patting it dry and around the area just to clean it. I'm going to use the rest of this, of course. Okay. Now this ulcer is only measuring at just under 3 centimeters. So I'm going to cut to form one of these non-adherent strips. These are oil emulsion pads to set atop of the ulcer area. So I'm going to take this oil emulsion pad that I've cut out and place it right atop of the ulcer area. So, right like so. Next, I'll be taking this Melgazorb AG pad and placing it right atop that. So I'm going to cut to fit, as well as take an alcohol prep pad again and sanitize my scissors with every cut. So this is cut to fit, and it's going to be placed right atop of the oil emulsion pad that I had cut. Now, before, what was happening is, for my last wrap, if you last watched our last wrap, we had actually had the 4x4 sponge with the betadine on top, which looks like this, the betadine solution, the 10% povidone iodine. But for this wrap, we have switched to the Melgazorb AG. And in regards to that, we did go ahead and cut out a portion. It is a pretty big pad that you can go ahead and probably get a couple cuts out of, depending on how big the ulcer is that you're working around. Now, from this point, we're going to just put a 4x4 gauze pad sponge right on top, and then we're ready to wrap. The podiatrist had 2 used. We will do the same. We'll use 2. Now these seem a little thicker, but this way any extra weeping or moisture that comes through will get absorbed by that pad. Now it can and does move around a little bit, so you want to make sure everything's all secure. I did make sure both sheets are directly on top of the ulcer area, as well as the sponge. Now for the wrapping portion, you're going to have to put down the stretch bandage right on top and then hold it with one of your fingers while using your other hand to keep everything in place during the wrapping. Now I will start from putting it this side and then wrapping this way, as well as cross behind the ankle as well. Now that I have my stretch bandage, this is stretch gauze bandage, out, I will go ahead and take it out of the package and begin my wrap process. It does come rolled and sterile. From this point, you could take it out and start your unraveling process around the foot. I have already gone 1 time around. I will want to do 2 before moving to other parts of the foot area. But there it is, like so. I did go ahead and cross wrap it around the ankle twice, 1 time on each side, and have come around another time as well. And I will go ahead and fold this over and then tape to the front side, the anterior side. So I have folded over the bandage, as you can see right there. So there's a little bit of leeway there. Now I'll get the tape out so I can go ahead and tape this up. Now you will need to hold it in place and then apply your tape to it. There's the first strip on, and now I will apply the second strip on. So there is the second strip on, just because I am going to apply a third strip as well. How it is safely and secured in place. The only thing is, when putting back on a sock, you do have to be careful about this area right here so that you don't peel back the gauze. So when you're putting the sock on, make sure you roll it inside out and have your hand tucked so that you get the toes in first, and then you're able to easily pull up the sock. And you've now just watched pretty much the complete unveiling, revealing, removal of the venous stasis ulcer anterior foot wrap bandage, as well as reapplication of it. Thank you all so much for watching. Don't forget to like and subscribe for more great videos. If you do have any questions, feel free to drop down a comment. Of course, once you're finished, make sure you put away all your supplies, sanitize important things like scissors, and do also bag up everything in their own baggies of supplies you will be utilizing for next time, like the remainders of your possibly Mel Jazorb AG pad or your oil emulsion pads as strips as well. Thanks for watching. Take care. Bye.